You ready?
Ready.
Since Ohm's not here, we'll get the slurping. All right. Happy Wednesday morning, everybody. Dr. Muse here with Dr. Kraft. We have a whole new team today. Dr. Ohm's out doing some training, so
we got the A team this time.
A team. It's been a couple weeks since I've been on here. Dr. Kraft took over for me last time, but happy to be back. So today, what we're going to talk about is something called portal of entry. So what does portal of entry mean?
It means how you get to a doctor.
Okay.
That we're primary care, right? Is that
right.
Yeah.
So chiropractors are primary care providers, meaning
that patients can come to us without a referral from another provider.
Okay. So, yep. So if you sustain any kind of injury or something happens, there's no need to go see somebody before you see us. You can definitely just call our office and get in, and we can do that initial evaluation. So that's what we're talking about today. So our goal overall as a clinic is to do a great evaluation. That's what we kind of pride ourselves on. So we've talked a lot about the McKinsey method stuff. I'm certified. You know some of the McKinsey, but
I've gone through some of the
Yes. We all know McKinsey method here. We're all trained in it. So, but our goal with these evaluations are to figure out, is this something that we can help you with, or is this something that we need to quote unquote punt out to somebody else?
Sure.
So give an example of something that, or a time that you've come across something like that.
Yeah, I mean, we see it all the time, but one that pops in, there's somebody that worked down the street. It was a patient that I've treated in her family forever, and somebody at work was complaining about knee pain. And she told him, just like, go to Kraft, he'll figure it out. Even if he can't treat it, he'll figure something out for you. And the guy came in the first visit, and we do an exam, and I was like, yeah,
you adjusted him, and he was better, right?
Well, not this time.
Okay.
But just on the exam said, you tore your ACL. There's nothing I can do for that, but we know some great knee surgeons, and we can definitely kick you over and get that fixed.
And that's so like we like to say, like we lose that ego in terms of knowing when some other form of care is needed. Now, the benefit of having these great relationships with physicians that Dr. Kraft and Dr. Ohm have built up over these last 8 to 10 years is that we have that great relationship where we have open lines of communication where even though we may be sending you out to another clinician, well, then once they do their job, that is something that then we could bring you back into the office and continue the rehabilitation after that point. So in the case of like an ACL rehabilitative process, like maybe physical therapy up front is like a little bit more hands-on, but then past that to regain function and get you back to doing what you love, I think that's where we shine a little bit. So just because we're saying, well, we can't help you today, that doesn't mean that in the long run we can't help you get back to your true form and function that you want to be getting after. An example, the reason why we're talking about this today is because I had one walk in just a couple days ago. Shoulder complaint. Patient was getting pulled up off the ground and had some immediate pain in the right shoulder. So she ended up coming in to see me, did my exam, pulled out some of my old athletic training knowledge from dealing with some acute injuries, and determined that, well, this is something that we should probably take a picture of, get an x-ray of. And thankfully that ended up being the right thing. We got the results back. Now we're going to pursue a little bit more imaging with an MRI. But the benefit of all this that I think saves time and money is that hopefully with our knowledge, we can get you in the right path of treatment much quicker than you may in other instances, right?
That's fair.
And so that's our goal, is not to waste time. Like we'll give it a go sometimes if we feel as though maybe a short trial of care would be good, but there's certain instances like that where something's just not right when we're looking at it. We're like, well, we need to go get a picture taken on this, and then hope probably past that get you to someone like an orthopedic surgeon who can take a look at it. Not ideal for the patient, but overall, in long-term care, this could be a money saver and a time saver where we can hopefully get you in the right place sooner. So, any other thoughts on any of those cases? No.
Not really, no.
Yeah, not the most fun ones to have walk in the office. We hate to be the bearers of bad news sometimes with those patients, but I think having the knowledge of what's actually going on can be a very powerful thing for the patient. So we always strive to give answers, whether it's that's something that we can treat, or give you an answer in terms of you need to go talk to this specialist that we can vouch for.
And even if it's an I don't know, but I know someone that will know kind of situation.
Yeah, how can we help you without actually helping you, if that makes any sense. But yeah, we hope you guys take something away from this. If you guys have any questions for us, make sure that you reach out, give the office a call, message us on Instagram or Facebook. But just to wrap it up, we can, in some way, shape, or form, help with just about anything without sounding, too full of ourselves. But even a little bit. But our goal, even if we can't help you directly, is to get you to the right person.
Yeah,
so,
definitely.
All right. Well, with that, happy December, everybody. Can't believe it's December already, but we'll see you guys next Wednesday, maybe with some new hosts. We'll see. But have a good one, guys.
Thanks.